compassion, spiritual care, and ethical decision-making are an expected aspect of the professional nurse, this emphasis is typically not integrated intentionally into the curriculum and is often left to chance. Clinical Dilemmas are a new series of clinical reasoning case studies that I've just created that emphasize and intentionalize the art of nursing, that integrates caring, spiritual care, nurse engagement, ethical decision-making, as well as clinical reasoning. These case studies can be used in the classroom as an active learning tool to develop clinical reasoning, the ethical comportment of nurses, as well as in the post-conference setting in the clinical setting. Students will also develop clinical reasoning as they identify what clinical data is relevant in each scenario, determine the nursing priority, and resultant nursing interventions. These 14 case studies are derived from themes that I have seen currently in clinical practice and represent the most common clinical dilemmas your nurses as students will see upon graduation. They are divided into the following 4 categories. Ethical dilemmas that include medical, ethical, and medical futility. Patient dilemmas, treatment care dilemmas, as well as nurse dilemmas that include incivility and that context of how nurses can be the change. Today, I will present a patient care dilemma of, is it pain control or is it drug-seeking behavior? The scenario. Angela Stevens is a 28-year-old woman who is post-operative day number 2 after a small bowel resection and lysis of adhesions. She has chronic abdominal pain that is due to severe Crohn's disease and has developed narcotic tolerance and dependence as a result. She has been clinically stable, but has been complaining of increasing incisional pain despite the fentanyl ropivacaine epidural drip that has been recently increased from 8 to 12 cc's an hour. She has Dilaudid IV push every 3 hours as needed for abdominal pain that remains persistently greater than 6/10 on a 0 to 10 pain scale. Her pain goal is to be 4 or less. Her social history. Angela is a single mother of 2 children, ages 3 and 1, who lives in her own apartment. She has struggled with chemical dependency in the past and denies any current problems. A routine urine drug screen before surgery was positive for benzodiazepines, even though she has no scheduled medications in this pharmacologic class. She is estranged from her mother and has little support at home. So the first aspect is we need to pause and look what clinical data is most important or relevant, therefore it has clinical significance to the nurse. All of that comportment is essential to clinical reasoning. Well, let's look at our history of the present problem. First, Angela is 28 years old, who is post-op day 2 after the small bowel resection for lysis of adhesions. It's important to note that the age of the patient is always relevant, and Angela is younger. Therefore, her likelihood of complications is less. But when we look at having Crohn's disease and prednisone, how does that influence and impact her likelihood of experiencing a potential complication because of altered immune status? Well, when the nurse has a deep understanding of pharmacology, prednisone, which Angela is likely on because of her Crohn's disease, is going to alter her immune status, and is something that must be recognized by the nurse. It's also important to note that because of Angela's chronic abdominal pain with Crohn's disease, she's going to need more narcotics to control the pain because she has developed narcotic tolerance as a result. This is expected, and this is what you see typically for any patient who has chronic pain and is on narcotics of any name or dosage as a result. So therefore, taking time to look at that is going to be an essential comportment here. Another aspect that's relevant is that she has been clinically stable, but has been having increasing abdominal pain despite the epidural drip being increased from 8 to 12 cc's an hour. Now that's a 33% increase, a significant increase in her epidural. You would expect that the pain would be controlled. But for Angela, it has not. And that might be related to her tolerance, or it could be related to something else. We'll have to take a look and see how this case study unfolds. She is also on Dilaudid 1 milligram IV PRN every 3 hours for pain. For abdominal pain that remains persistent at greater than 6/10. Now, it's not uncommon for a patient on an epidural drip to receive supplemental narcotics intravenously if needed. But recognize that the epidural is also fentanyl, which is a small dose of narcotic. They do not require as much narcotic because the fentanyl and the anesthetic agent of ropivacaine are in the epidural space. That is the benefit of why we often see surgical patients managed with epidural narcotics and anesthetics. But when we look at Angela, her pain is still not being controlled. The Dilaudid 1 milligram, the nurse needs to recognize, is this a small, average, or larger dose range when you look at Dilaudid? And when a nurse has a deep knowledge of pharmacology and Dilaudid, 1 milligram is, at a time, a pretty significant dose. Usually we're going 0.25 to 0.5 for an opiate-naive patient. But because Angela has the chronic pain overlay, this is not unexpected. And so therefore the nurse just needs to recognize that she is giving a higher dose range, but still a safe dose to administer. As we look at the social history, Angela is a single mother of 2 children, ages 3 and 1, who live in her own apartment. So she's a single mother, and she struggled with chemical dependency. Now, as we look at this aspect, she is chemically dependent by history, but currently that does not seem to be a problem. But a routine drug screen revealed that it was positive for benzodiazepines, even though she has no scheduled medications in that pharmacologic class. Now, we know that the most common benzodiazepines are Ativan and Valium. And this is a problem. In order to recognize the significance of this problem, recognize that when we use conscious sedation for short-term sedation in the emergency department, for example, we often use intravenous narcotics such as Dilaudid or fentanyl combined with a benzodiazepine such as Ativan or Versed, because they synergize and they increase sedation. In Angela's case, she's already on oral narcotics and is taking, according to her drug screen, oral benzodiazepines, which has the same effect. Therefore, this is another red flag that the nurse must recognize, and there is a problem in this context of Angela being a single mother and having 2 dependent children, and she may be in a position where these children may be subjected to neglect, and is something that the nurse needs to recognize and consider the need to consult social services as well as child protection. The last psychosocial concern is that she's estranged from her mother and has little support at home. So Angela is isolated. She doesn't have a lot of support as a single mother, and therefore these current potential concerns for chemical dependency need to be recognized. So let's begin with the dilemma begins in the current concerns. It is now 2 days later. It is post-op day number 4, and the epidural drip was discontinued earlier today. She has been watching the clock and calls the nurse precisely every 3 hours when she can have her next dose of Dilaudid, 1 milligram IV push. Despite her high level of pain that she consistently rates at an 8/10, the nurse does a full set of vital signs and her heart rate is 70. Her blood pressure is 110/68. When the nurse observes the patient discreetly through a window, Angela is texting on her phone and appears in no acute distress. As soon as the nurse enters the room, she puts the phone down and begins to moan loudly because of her pain. As we look and use the aspect of clinical reasoning in this scenario, what data is relevant as well as clinically significant? Well, as we look at this scenario, she's now post-op day number 4, and the epidural drip was discontinued earlier today. Now, we do expect that she may have some increase in her pain because the epidural was decreased, but she's also post-op day number 4, when we would expect pain to be decreasing. Also, she's been watching the clock and calls the nurse precisely every 3 hours when she can have her next dose. Now, this by itself is not a red flag for potential drug-seeking behavior, because when a patient is in pain, they want to know when can they have that next dose, and putting that on the grease board or the care board, if your unit has that, is totally appropriate and expected. But despite her high level of pain that she rates as an 8/10, her heart rate is 70 and her blood pressure is 110/68. Now, when we use clinical reasoning, as well as the decision-making that is also expected on the NCLEX, is this expected or unexpected if she is in severe pain? Now, typically the nurse would expect to see the heart rate elevate and the blood pressure increase, one or the other or both, with severe or high levels of pain. But Angela's levels are not excessively elevated, and the nurse needs to consider this data to put this scenario together. Now, again, with patients in chronic pain, they oftentimes do not have the same excessive response or the stress response to the episode of pain, but you would expect to see something. And at this point, it appears that there is not any takeaway. Now, it's commonly taught in nursing education that pain is whatever the patient says it is. Now, that's a good principle, but unfortunately, we live in a culture where opiate narcotics are abused more commonly even than illicit substances. Therefore, in our culture, narcotics are used excessively and used inappropriately. Therefore, the nurse also needs to consider the potential for drug-seeking behavior in this scenario. But the next piece of data is extremely concerning. That when she looks through the window, she's calm, but as soon as the patient sees the nurse, she begins to moan and groan as if she's in severe pain. And this is a red flag that cannot be disregarded by the nurse. Because when you see this change of behavior by a patient when they see the nurse versus before they were calm, that is typical. And what I have seen in clinical practice when there is a suspicion of drug-seeking narcotic behavior by the patient. So now let's resolve this dilemma. And let's go to the series of several questions that the student must engage and answer. The first question, identifying data that is relevant. What is the essence of this current dilemma? Now, identifying what is relevant as well as the essence is an important component of clinical reasoning. And there really are two in this scenario. The first is the concern over the well-being of Angela's children over the potential abuse of benzodiazepines and the need to initiate a child protection referral or assessment, as well as involving social services. The second dilemma is the potential misuse of pain medications while Angela is in the hospital that may indicate drug-seeking behavior or addiction. Second question, what additional information is needed by the nurse that would help clarify the current dilemma? It is so important that the nurse does not rush to judgment and make assumptions about Angela in this situation, but always being open-minded. What more information does the nurse need in order to cluster additional data to make the correct and the best clinical judgment? Now again, when we look at Angela's children, we need to again recognize that that referral will be needed and be looking at what I would like to know is there a legitimate or potential plausible explanation for why there were benzodiazepines in her urine? And Angela needs to be given the opportunity to explain what that rationale is, or if she completely denies it, which would be more concerning. But this information is essential, and the nurse must ask open-endedly without making a judgment what was found, what is her response, and then to document this in the medical record. The potential concern as it relates to the misuse of pain medications while Angela is in the hospital, again, we need to clarify what the potential problem may be in this situation and basically have the patient clarify basically her response that did not appear to be that stressful, what's changed, and have that patient explain what the nurse is seeing to see if they connect and if they are relevant. Number 3, the third question in this scenario, what additional members of the healthcare team could be utilized in this dilemma and why? It's important to note with any dilemmas that a nurse experiences in practice, you are not alone. You have a team. And in this context, it's important to contact social services as a key member of the team to look into the concern with the children that may be present, as well as the primary care provider to communicate what information you have observed and assessed relating to the potential for her narcotic abuse and the way that she is responding in this context. Fourth question, what is the nursing priority? Now, textbook learning is linear, and that's a shortcoming. In real-world practice, we have multiple streams, multiple threads of practice. And in this context, we really have 2 psychosocial problems, which, again, for the safety of the children who may be experiencing neglect, there's no NANDA statement for that, but simply using a tenet of clinical reasoning by describing the essence of the problem, we can basically make that statement. And again, safety is essential in this context for the children. Secondly, for the nursing priority, the misuse of pain medications that may indicate drug-seeking behavior. Now, a potential NANDA nursing diagnostic statement may be ineffective coping, but this again is not that clear at this point in time if that would truly fit. And again, we don't want to search NANDA to make something fit. We want to just simply and concisely state what the problem may be and the priority as a result. Fifth question, what nursing interventions and principles can be utilized by the nurse to successfully resolve this clinical dilemma? Our goal is not to, is to resolve this in a way that is best and a win-win for everyone. First of all, again, the safety of the children, notifying social services, calling child protection. As it relates to the second problem of Angela's misuse of pain medications that may indicate drug-seeking behavior, some common interventions that the nurse could utilize is, again, contacting the care provider, as well as avoiding assumptions. Do not rush to judgment. But again, clarify every piece of clinical data that you have collected, collaborated, make a clinical judgment, as well as continue to support and manage Angela with a non-judgmental attitude is essential, as well as continuing to collect vital sign and pain control data and to document that. 6. What is the expected response of the patient that would indicate these nursing interventions were effective? Well, as we look at the drug-seeking behavior and that potential, that is something that's going to be very difficult to really do in this scenario where you're looking for insight. Is this even a problem, or is the nurse misinterpreting the data that has been collected? But I think it's important to kind of, in a gentle way, to just acknowledge what you're seeing. I've seen that most patients, especially in the ER, who appear to have some drug-seeking behavior to their presentation get extremely defensive and are not going to have insight. That's typically for a 12-step group. If they have that insight and their life becomes unmanageable as a result of addiction, then you will see patients willing to at least be transparent and have that honesty. Don't expect it, though, in the clinical setting. Number 7. What response by the patient would indicate that a change in the plan of care and nursing interventions are needed? Well, if the patient became angry, hostile, and excessively defensive when the concerns about her benzodiazepines in the urine was brought to her attention, that would be extremely concerning and relating to that, supporting the suspicion that we do have some narcotic or some addictive behavior that has resurfaced. And again, the safety of the children being a priority. Number 8. What is the patient likely experiencing or feeling right now in this situation? This really gets to the heart of caring and nurse engagement. Because what you want to do as a nurse is to empathize with each and every patient that you care for. Not to rush to judgments, not to see yourselves as better than Angela because you're not an addict and you haven't struggled in this area, but to really kind of get down on her level and to really see what is she experiencing. What is the reasons that Angela has struggled with addiction in the past? Would it make a difference if maybe Angela had been sexually abused as a child and is struggling with that deep wound and is looking to drugs as a way out of her emotional pain? Would you have more empathy if you knew that? Again, recognize the importance of what's she feeling. She's obviously anxious, but there also may be some overlays that are also concerning. The 9th question. What can you do as the nurse to engage yourself with this patient's experience and show that she matters to you as a person? You know, Angela does not need to be judged. You know, just as Christ said to the woman caught in adultery, he who is without sin, let him be the first to cast the stone. We're all on the same field, and we've all made mistakes. We've all made errors in judgment, and we need to basically kind of get into her skin and engage with her and show that she matters. And so that really gets to the heart of caring. And again, looking at some of those strategies of just being empathetic, I think it's important to avoid assumptions. That's really a key caring intervention, that whenever the nurse makes a judgment, informed or not, that nurse ceases to be caring. And that relationship is something that we all need to keep before us in practice. Myself, as a nurse of over 30 years, I still need to remind myself of that, especially when that frequent flyer is back in the emergency room once again. Well, this is the essence of this clinical dilemma activity that's available on my website, KeithRN. This is one of 14. And each case study that I've created in this series has a PDF student version that is blank, as well as a fully developed answer key for faculty. But again, feel free to roll the way you choose to and not have to go with the answers that I kind of have unfolded. But again, there is some art to all of this, and the nurse and the educator can use that discrimination. So again, go to my website, KeithRN, click the Clinical Reasoning Case Study button on the home page for more information. Be sure to check out my other videos on YouTube, the channel Think Like a Nurse, as well as follow me on Facebook at Think Like a Nurse, as well as Twitter at KeithRisherRN. And again, thank you so much for all that you are doing to be a part of the needed change and transformation in nursing education. It is my pleasure to be a part of that and to partner with you in this journey. Thank you.